It is now my pleasure also to invite the acting CEO, National Cancer Institute Kenya, his representative, Dr. Mwangi, to give brief remarks on behalf of the CEO. Karibu, Dr. Mwangi. Makofi kwa Dr. Mwangi.
Thank you very much. Our Principal Secretary, Hilary Kimtai, Director General, Dr. Moth, our WHO county representatives, our development partners, our CECMs and county government officials, civil society, our NCD stakeholders, members of the media, our invited guests, all protocols observed. Ladies and gentlemen, good morning. For us as an institute, it's an honor to join you all here on this monumental day. We are most sincerely thankful to the leadership of the Ministry of Health, led by our Cabinet Secretary, for the support that has been accorded in the process of development of this third National Cancer Control Strategy, 2023-2027. We are also very thankful for the support that has also been provided to the Institute in steering the cancer prevention and control in this country. As an institute, we deliver our mandate as provided by the Cancer Prevention and Control Act 2012, which spans across all the pillars within this strategy. And we are very happy that the journey has brought us here. It has been an inclusive and also an exhaustive journey. At NCI, we continue to bring on board all actors in a collaborative manner to ensure that we deliver on reducing the burden of cancer in Kenya. So as we deliver this burden across the continuum of care, prevention measures that have been mentioned here, from vaccination to public awareness within the community, mainstreaming of cancer across the different ministries, government agencies, and even organizations, increasing screening and ensuring that those who are diagnosed with cancer are receiving quality treatment in safe environments within the Republic of Kenya. We also recognize that our health is a devolved function, and we are also working as an institute to make sure that we engage the county governments so that we are able to prioritize cancer within the county governments through the departments of health in the county governments, through engagements with the county assemblies, and also assisting the county governments come up with county cancer action plans that will improve the response to cancer. The Institute has also established a national cancer registry that clearly demonstrates the burden of cancer across the counties, and this is supposed to help support the counties have evidence-based planning and decision-making while we look at ways and innovations of responding to the burden of cancer. As an institute, we commit to work with all stakeholders to deliver the goals in this strategy. We also endeavor to continue learning through research and steering the cancer response discourse, and look to all of us, each one of us, in having continued support to strengthen the cancer prevention and control response, and ensure that we implement, monitor, and evaluate the work that will come out of this strategy. I want to thank you and congratulations. Thank you very much.
Thank you very much, Dr. Mwangi, for very ably representing the CEO, NCI Kenya. Our chief guests, the next remarks are to be from Professor Nicholas Mbinya, who led the process of developing the NCCS but I'm told he was not able to join us today. Kindly accept his apologies. And having said that, I now want to invite the representative of COGs, and that will be the CECM Nandi County. The CECM Nandi County, we also kindly request you to introduce the other CECs who are with us today, so that we would want them to feel very, very much recognized and appreciated. Asante sana. Tumkaribisha na makofi. Thank you.
You just want them to stand?
Yeah, just to stand.
Okay. Our Principal Secretary of Medical Services, Mr. Harry Kimutai, our Director General, Dr. Amoth, the CEO, National Cancer Institute, the Chief Executive Operations representing government partners, the WHO County Representative, representation from the civil society, representation from the development partners, my fellow colleagues, distinguished guests, ladies and gentlemen, good morning. Allow me to have my fellow colleagues, the CECMs in charge of health from the counties, to stand up. The team here today is the team that is committed to ensure that whatever is in the strategic plan will be well implemented in the counties, and the communities and survivor involvement will be there. There'll be social justice, the UHC agenda, the patient-centered care, the evidence-based interventions, equity and inclusivity that is in the strategic plan. Thank you so much. You may sit. Allow me, I don't have a written speech, but allow me to first say that this is a very important day for the country, Kenya. All stakeholders have been involved during the preparation of this strategic plan, and we all know that all of us sitting here today has been, one way or another, been affected by cancer. And I like to always say that cancer is in every village, cancer is in every community. Your workmates, your churchmates, everyone has been affected by cancer. And what came out clearly from all the stakeholders was we have never made enough noise about cancer. And globally, about 10 million deaths happen with cancer. Cancer is a global problem. And if you look at the cancer cases that have happened globally, no one has made the noise that it so deserves like we did with COVID. I say so because from the 10 million deaths that we have, it means a plane crashes almost every day, not just one, but many. 52,000 737 Boeing flights crash yearly. I don't know if all of you are listening to that, which means in Kenya alone, 174 flights crash, and whenever there is a plane crash, it will be on CNN, it will be on Fox News, it will be on Al Jazeera, it will be on NTV, it will be on Citizen every 15 minutes. But the magnitude of the patients we lose to cancer is immense, all recognized by all the stakeholders here today. Denmark, Belgium, Australia, and those first world countries leading with over 300 patients, over 1,000 dying to cancer in their populations. In Kenya, we are half, but the lowest globally is Niger, Nepal, Congo, our neighbors, South Sudan and Sudan. And being a global problem, sometimes we are looking for solutions elsewhere. We should go to our neighboring country and find out what disparities, what is happening there. Likewise, look at what is happening globally in areas where they have high numbers. We have all said that we must take research seriously and see what is happening in those areas so we are not affected. Cholera took 31 years to go from South Asia to the Americas and 10 years to get to Africa. COVID took less than 3 months, and it was a global experience for everybody. Whatever happens in those countries with high incidences can happen here in Kenya too. So it is important we look at it as a global problem. We need to be futuristic and look for sustainable measures. As counties, we are committed to ensure that we provide the preventative services, the early diagnosis, the wellness that has not been embraced very well, the holistic care from prevention to end-of-life care. There is still inequity across the country on cancer services, and as we all know, radiation that has been mentioned is only provided in very few institutions. KNH, Nakuru, MTRH, and sometimes we have our patients going by to the neighboring Uganda. So part of the strategic plan is to ensure equity in access, as time is very essential in ensuring the survival of our patients. The HPV vaccines has been implemented in counties, and I know many counties have partnered with KEMRI on the HPV testing, showing more than 20% of those tested randomly being positive and giving a chance for those under the age of 30 to receive the vaccine that is life-saving. We've also mentioned the investments that counties have done on HRH. It is also very important to look at our gaps in areas that support cancer, like radiology, oncology, pathology, and reconstructive surgery. Most also important is the pediatric population. The pediatric population, the goal is to ensure their survival is more than 60%. Globally, pediatric oncology patients have a 90% survival. Our long-term goal is to go for what is there out there globally. Our pediatric patients so deserve the care that they need, and we have to invest in the HRH training, not only for the general population, but the pediatric patients. On the disease registries that we have, it is also a time that we partnered with many institutions locally and globally to ensure that we can geomap and see where these patients are coming from. The solutions may be within our communities. We must work with the communities and see in the high prevalent areas, what can we do for prevention to ensure that we don't lose more people to cancer. One of the successes we've also had in counties, we have a handful of oncologists, but many counties have used telemedicine to ensure that no care is delayed, whether in imaging or consultation on the drug regimens to give. As counties also, we are committed to ensure that the commodities that are needed for diagnosing and treating our patients are provided timely, as well as to make services available such as imaging, mammography machines are available, but the use is not what it should be. So sometimes it's not a matter of the availability of the equipment. It is a matter of the citizenship involvement on using the imaging machines, as we all know that if caught early, we can do early interventions. So more advocacy needs to be done to reach out to reduce the inequities. We need also to invest a lot on health literacy, not only on the caregivers, on the populations, but also on the family members who take care of their loved ones to ensure that the treatment is done well. And also for the common population to access the free screenings to prevent cancer. On policy reforms, NHIF has done a lot of reforms. The continued reforms will ensure that the inequity of cancer care is covered, such as no delay of treatment for patients suffering with cancer, and also ensuring they get the entire full regime that improves their survival. In the cancer reforms, we would also like to ensure that we all work together to make cancer care affordable. If you go to India, the amount of money used to treat prostate cancer, it costs us in Kenya what you would use to treat 5 patients. So part of the problems that we have is making healthcare affordable by making commodities also affordable. Synergy from all levels, from all sectors, the private, county governments, Ministry of Health, the private sector, communities, all stakeholders, the academia, will ensure that cancer care in Kenya will be equitable. Calling upon the private insurance, it is also time for them to make reforms where they cover for early diagnosis and prevention to cover cancer care, not just the curative care. So it's all our responsibilities to go and make the noise, and for the resource available that causes the inequities of care in cancer. It is time we took a global perspective as a country to ensure that healthcare is funded. As a country, we are still at the 11% of the Abuja Declaration. Counties are investing more than 30% of their budgetary allocations, but it is very clear with the many success phases that have happened in counties, counties still remain underfunded compared to the pre-devolution era. So as a country, we must care. There is no such thing as a free lunch. And with a good social health insurance, no one will be denied access to health care in Kenya. We need to value how we finance health insurance so that we achieve UHC with minimal burdens that we see cancer creates so much poverty across our populations. As Kenya becomes a mid-income economy and the partners are slowly moving out, we must also look at the internal resource mobilization as well as make it a multi-sectoral agenda to run health matters, like agriculture running food safety measures to ensure that we have safe food and less cancer. Running nutritional programs that ensures we have a healthy population. We must also include education, environment, as well as public works and the manufacturing industry, as we value data and issues that may be causing cancer in our community. We must all work together and take the other sectors as partners to run the health agenda so we can have more funding for other issues. We must not forget that as counties, we are committed to providing proper cancer centers, that our staff are safe, our patients are safe, and their cancer and their caregivers are safe by having good IPC standards and proper waste management in cancer care. We must also ensure that alternative medicines in our communities do not set us back. So in this agenda, we covered being patient-centered, community-centered, by ensuring that the practices in our communities don't delay care or don't have myths that will affect our patient care. We still have an opportunity in palliative care, and during COVID-19, where we did home-based care, many counties have taken the opportunity to expand services for home-based care for our cancer patients. Pain management being one of the issues, as well as the mental health support that the patients and the caregivers so much need. Thank you so much. May God bless you. And as county governments, we are committed to ensure that the good documents that we make, the good policies that are made, are implemented well in the counties. Thank you.
Thank you. Thank you very much, the representative of Council of Governors. We are happy and proud to be associated with you. And we also are very happy by the support you are giving us, particularly by that is evident from the large members of CECM who have joined you today. So we are very, very proud of that. Now it is the time for WHO country representative, Abrahaman Diallo, to give his remarks. And for today, he's represented by the very able Dr. Ihioma. Hope I've gotten the pronunciation today. Karibu, Dr. Ihioma.
Thank you very much, Dr. Mare. The Principal Secretary, Harry Kimtai, please forgive me if I don't pronounce the names correctly. DG Patrick Amoth, Dr. Wangi, representing the CEO for NCI, Dr. Zipporah Ali, Chair of the NCD Alliance, the CEC CM for Nandi and other CEC CMs here present, the NCCP team of the Ministry of Health, Dr. Gerald Macharia of CHAI, and other development partners here present, all other protocols observed. My name is Ihioma Onwekusi. I tend to pronounce my name very slowly. I am not the WHO representative. I am here to present the remarks of Dr. Diallo, the WHO representative, who is unable to attend this event and has sent his apologies. So permit me to read his remarks on his behalf. It's a great pleasure to be with you this morning as the country launches the National Cancer Control Strategy 2023 to 2027 and other related documents. A big congratulations to the Ministry of Health and partners for this great achievement. Cancer is a leading cause of death worldwide, as already mentioned, accounting for nearly 10 million deaths in 2020. Around 1/3 of deaths are due to lifestyle activities, including tobacco use, alcohol consumption, lack of physical activity, low fruit and vegetable intake. The cancer-causing infections such as human papillomavirus and hepatitis are responsible for approximately 30% of cancer cases in low and lower middle-income countries. All these are preventable causes that we can bring to a halt if we all join hands together. Many health systems in low and middle income countries are least prepared to manage this burden, as large numbers of cancer patients do not have access to timely quality diagnosis and treatment. Many cancers can be cured if detected early and treated effectively. WHO continues to support member states to promote national cancer control policies, plans, and programs that are harmonized with strategies for non-communicable diseases and other health-related concerns. As a technical agency, we set norms and standards for cancer control, including the development of evidence-based prevention, early diagnosis, screening, treatment, and palliative and survivorship care programs, as well as to promote monitoring and evaluation through cancer registries and research that are tailored to the local disease burden and available resources. To strengthen national efforts to address the burden of cancer and other NCDs, the WHO Global Action Plan for the Prevention of Control of NCDs 2013 to 2020 provides a roadmap to reduce premature mortality from NCDs by 2025 through targeting many of the risk factors to major NCDs, including cancer. In 2017, WHO launched the Guide to Cancer Early Diagnosis, which aims to help policymakers and program managers facilitate timely diagnosis and improve access to cancer treatment for all. By developing effective strategies to identify cancer early, lives can be saved, and the personal, societal, and economic costs of cancer care are reduced. In 2020, the World Health Assembly adopted the global strategy to accelerate the elimination of cervical cancer as a public health problem, while in 2021, WHO developed new guidelines for screening and treatment of cervical pre-cancer lesions for cervical cancer prevention. In the same year, WHO launched new tools to help countries build effective childhood cancer programs and established the Global Breast Cancer Initiative. Together, we can promote healthy lifestyles, prevent cancer, put measures in place for early detection, effectively treat and cure cancer, and provide quality life through palliative care. As WHO, we will continue providing the necessary support towards prevention and control of cancer in the country of Kenya through the effective implementation of this new cancer control strategy. I thank you for your attention.
Let's give Dr. Hioma another round of applause. Thank you very much. Before I call our DG Health, I want to take this opportunity to just request, through the permission of our chief guest, the representative of FIND and BD, just to stand and wave to the crowd and the chief guest. Well, we have the two organizations have really been instrumental to development of this document, sir, and we really do not take that for granted, and we are very, very much appreciative. Likewise, we had one Elizabeth Mora who was supposed to do a poem, but because of time, we could not have the poem. Maybe you can stand so that she's as tall as me. Karibia hapa uonekana na chief guest, then you wave and sit down. Pengine upatiwe dashi. Okay. Asante. Thank you.
Ayashime wananchi ya Mgambo inalia, abadani sijifichi, mambo yametulemea, kuwauliza misiwachi, mwenye jibu na ngojea, tutoe ugonjwa wa kansa ili tuwe na neema. Waziri wetu Susan kasema, kila mtu kasikia, kansa si ugonjwa nzuri, yamaliza wanadamu. Nukta tukilala hospitalini, hatuna pa kwenda. Hongera Waziri Susan kwa yote ulioyasema. Asanteni.
Thank you very much. I think that sets the stage very well for our DG. And it is now my pleasure to welcome the DG to give his remarks. And also, after that, he can invite our chief guest to address us. Thank you very much. Karibu, DG.
Thank you, Fantas. Our chief guest, the Principal Secretary, State Department of Medical Services, Harry Kimtai, CEC members of Health present, and thank you for coming out in your tents. The WHO representative, I will not mention the name, the representative of the CEO of National Cancer Institute, the representative of the chair of the NCD Alliance, Gerald Masharia representing the development partners, colleagues from the Ministry of Health, civil society organizations present here, the academia, members of the Fourth Estate, distinguished guests, ladies and gentlemen, dear friends, good morning. I also want to take this opportunity to join all of us as we launch these 3 strategic documents. We know the burden of cancer in this country is huge, like in the global arena, and the ministry continues to prioritize cancer amongst the other NCDs, including the metabolic disorders like diabetes mellitus and cardiovascular diseases, which form the largest bulk of the NCDs, not forgetting the rising burden of mental health. And cancer is a priority for us because of 3 reasons. 1, the number of cancer cases in this country is on an upward trajectory. Actually, it is estimated that by 2040, the total number of cases in this country will double. Number 2 is the expense you incur when you are diagnosed with cancer. It is the leading cause of catastrophic health expenditure. And catastrophic health expenditure actually leads into poverty, because when you have a family member diagnosed with cancer, family members will be able to do everything within their means. They'll be able to sell all their properties to ensure that the family member gets treatment. And in that process, they get into abject poverty, therefore affecting the entire household. As a country, we estimate that if you are diagnosed with cancer, and unfortunately most of our cancer cases are diagnosed late, the total expenditure in treatment is more than 1 million Kenya shillings. If you multiply that by the estimated number of cancer cases, which is about 85,000, that comes to 85 billion Kenya shillings. Our total health expenditure is estimated at 300 billion. So one disease alone nearly takes a third of our total health expenditure. So that situation is untenable, and therefore the launch of this document is critical to be able to change that scenario. And what is fundamental in this document is now the shift from focus on curative cancer services to preventive and promotive along the primary healthcare approach in our journey towards universal health coverage. Why primary healthcare? Because primary healthcare tends to be integrated. It is holistic. It promotes equity. It promotes coverage and access. Therefore, services will be closer to the people. And when we are talking of prevention, in our own studies done here in Kenya, $1 invested in prevention gives a yield of $16. If that was a pyramid scheme, all of us will join in their droves. This document being launched here today has 5 critical pillars, including awareness creation, early diagnosis and screening, treatment along the continuum of care, and we believe through the primary healthcare approach we'll be able to strengthen our healthcare system to be able to respond to this rising burden. Number 3, cancer investments require a lot of resources, not only in the health ecosystem, but also in the non-health ecosystem, for us to be able to change the narrative. Therefore, as a ministry, we are going to prioritize integration of cancer care services, promoting prevention and health promotion, to ensure that we can be able to pick cancer cases early and therefore reduce the cost of treatment. As a continent, Sub-Saharan Africa suffers a huge burden of cancer that is caused by infectious agents. Cancers that have infectious agents as antecedent, including human papillomavirus, which we introduced a vaccine against in 2019, and as at now we have achieved 58% coverage. We believe we would have done much better had it not been for COVID-19 pandemic, when schools were closed, and we plan to be able to do a catch-up vaccination to ensure that girls who are 10 to 14 years are reached with this single-dose vaccine that is life-saving. Data from the recently released Kenya Demographic Health Survey again shows the behavior. Screening for cancer of the cervix, a paltry 17%. For cancer of the breast, 14%. And therefore, we need to work together as one whole society, all the sectors involved, so that we can be able to change these figures for the better. With those few reflections, it is now my singular honor and pleasure to invite the chief guest, our principal secretary. A round of applause for PS as he comes. Asante.
Thank you, DG. I want from the onset to state that our Cabinet Secretary, Honorable Susan Nakumicha, was our chief guest. She was going to preside over this function, but because of other engagements, I'm going to read her speech. Let me start by acknowledging the WHO country representative, the Council of Governors representatives that are here. I want to thank the CECs for coming out in large number, and that gives us assurance that indeed health is a devolved function. We're really happy because of that. The development partners that are here today, you have been mentioned personally, and I want just to acknowledge a few, led by your chair, Mr. Macharia, who has given us an insight and has told us what we need to do as we develop this strategy. Members of the civil society, led by Dr. Zipora, and I really want to appreciate that you're not just leading, you have also been a practitioner, and you have supported care of cancer, and we're really happy that you are now playing that role. The members of the private sector who also have contributed a lot to support the ministry in coming up with this strategy and policies, led by our partners, BD, and the gentleman. Thank you so much. I'd had a lot of engagement with BD, and we're very happy with what they're doing, and I hope that we partner together both at the national level and the county level, because I've seen the strategy that you have developed is really going to help us, because you've gone to the county and you want to work with the national government in terms of the national reference laboratories that we have, and therefore that is the real bottom-up approach that we want to see in the healthcare sector. The representatives from the professional organizations also present here, led by the academia, we want to thank you, because the research component is really critical. I'm just discussing with the representative of the CEC here and was telling me, look, without data, it's going to be very difficult for us to intervene. And I really want to thank the professionals, organizations that are spearheading that area. Therefore, ladies and gentlemen, can I say good morning? I think it is still good morning. It is a privilege and honor to stand before you today on this vital moment as we launch our country's third National Cancer Control Strategic Plan. On this occasion, we demonstrate the Kenya Kwanza government's commitment in the fight against cancer. The strategy document we are launching here today operationalizes the Kenya Cancer Policy 2019-2030 and is well aligned to our global and regional commitments on the cancer. The Constitution of Kenya and the ministerial policies, and specifically the bottom-up economic transformation agenda. The government, under the leadership of His Excellency, the President, Dr. William Samoei Ruto, remains focused on delivering the Afya Bora Mashinani universal healthcare coverage, focusing on health financing, human resource for health, health products and technologies, and digitization through the bottom-up economic transformation agenda. Our focus, therefore, is on improving the primary health care as an intermediary step towards actualizing UHC through ensuring the provision of a core set of essential integrated health services, including cancer screening and early detection. Already, we have put in place mechanisms for multi-sectoral action, enabling and empowering people and communities to take charge of their health. This January, I launched the 5th National Cervical Cancer Awareness Month in Runyenjes, Embu County, where we created public awareness on the cervical cancer and screened 368 women and more than 40,000 women countrywide in that month alone. Again, during the National Cancer Summit, we were able to convene a multi-sectoral team of stakeholders to discuss the cancer issues. During the World Cancer Day on 4th February 2023, I launched the Garissa Regional Cancer Center, the first in the northern region of the country, through collaboration between the Ministry of the national government through the Ministry of Health and the county government of Garissa. This center continues to provide comprehensive cancer treatment services to the marginalized communities in this region, many of whom may not have been able to access this due to the geographical barriers. I am happy to note that the document we are launching today is well aligned to the Vision 2030, and this will ensure we collectively produce the desired results of our nation, free from the preventable burden of cancer for economic prosperity. As a nation, and I'm also well aware of the fact that the cancer scourge has metamorphosed into deadly health threat across the Kenyan population. Somebody said here that there is no person who is sitting here who have not been touched or affected in one way or the other with cancer. We recognize the various gaps we face, including the low public awareness on cancer and its risk factors, cancer stigma, and the common myths and misconceptions that have contributed to the low uptake of the cancer screening services. The reason being is that once you're diagnosed with the cancer, it's like a life sentence. So can you imagine? Who wants to go there to be told that you have cancer and you still want to live? So it is really stigmatizing, and I feel that we need to talk about it. So the CEC has talked about it. Cancer awareness is key, and it's important that we start talking about it. I am aware of the health system's challenges, including access to cancer diagnostic services that contribute to delays, late-stage cancer diagnosis, and therefore, this is really a common challenge, because by the time we are diagnosing some of the cancer patients, we are told it is stage 4. There is nothing you can do. Even our doctors will tell you there is nothing that you can do. So I think that's another area, and I'm very happy that using the new technologies now, we need to start screening much early before it is too late. I think the other issue is on the high cost of treatment and the low survival rates. Going forward, we are going to spearhead efforts in improving the cancer diagnosis countrywide. And this has been demonstrated in the regional cancer centers that is being established across the country. My ministry, in this new plan, will also prioritize improving public awareness and knowledge on cancer, as well as strengthening the health systems to better address the burden of the disease right from the community level. Indeed, cancer screening and early diagnosis services should be available at all facilities and will be part of the UHC benefit package that we are soon going to launch. As a ministry, we are re-energized and inspired by the progress and the milestones we have achieved so far in the fight against cancer. Remarkably, our scorecard for the implementation of the second National Cancer Strategy, which ran from 2017 to 2022, shows that the majority of the planned activities were either fully or partially achieved, with only 7% not achieved. This is not a mean feat, and we are very happy that as we launch the third cancer strategy, we are going to put it also under the UHC program. And therefore, our success rate we target to be 100%. The success stories points to a joint effort led by the Ministry of Health through the National Cancer Program, National Cancer Control Program, working with the county governments, partners, and many other actors in the cancer space, whom we acknowledge today for their contribution and commitment. Ladies and gentlemen, as I conclude, allow me to appreciate the county governments represented here today. And I was telling my sister here that she has spoken for the 47 CECs, those who are present here and those who are in their counties. Thank you so much. The UN agencies that have also spoken here, development partners who have given us their support, civil society for the action they are taking, the stories that they're giving us. And thank you, Maura, for that very nice poem. Indeed, it was a message well sent, and we need people like you to be the champions of this disease. Civil societies, as I've mentioned, and all other players that have made this day a success. Success stories are less about competition and more about collaboration. The truth is, we require the support of everyone to win against cancer. Finally, ladies and gentlemen, I urge all of you to continue working tirelessly in implementing this strategy to achieve our goal to reduce the preventable burden of cancer by 1/3 by 2028. My ministry will continue to work with all partners and will not relent until we achieve our goal. Thank you, and God bless you.
Principal Secretary for State Department of Medical Services, Mr. Harry Kimtai, our Director General, Dr. Patrick Amoth, the country CECM, the county directors of health represented here today, the WHO country representative, the civil society representative, Dr. Zipporah Ali, development partners, CHAI, BD, FIND, and many others who are here today. The CEO, National Cancer Institute of Kenya representative, members from academia, professional organizations, and members of the Fourth Estate. Good afternoon. On behalf of the National Cancer Control Program, I wish to express my sincere gratitude and vote of thanks for each and every one of you having supported us this far. Indeed, the formulation of this document and its launch today is a great occasion for the cancer space in Kenya, and this would not have been possible without you. We appreciate the collaboration from each and every one of you, and want to convey a very special thanks to the county governments who have been engaged throughout this process and will continue to be key in its implementation. In the next phase, we will disseminate this document to all counties for their ownership and use. I really want to appreciate the county governments who have come in great numbers to witness this occasion. We will continue to work with all stakeholders on board. I want to say that the fight against cancer cannot be won by one entity alone. It requires all of us to come on board together and work collaboratively. We will work through our technical working groups to provide the relevant oversight and technical support and ensure that the meal framework is fully implemented. With those few words, I just want to say thank you, and thank you. God bless you all.
We have now officially launched the strategic National Cancer Control Strategic Plan and the relevant document which will enable us implement that strategic plan.